So, when it comes to patient history, like you mentioned, so much can happen to lead to any diagnosis that everyone's uh, a bit unique. How are we tracking the trends from patient to patient? Because we're talking a lot about machine learning and artificial intelligence, and doctors don't have all the time in the world, and from past clinical trials to maybe some novel cases, and outliers and things like that. I'm wondering if there's any conversation, I'm sure there is, about tracking some of this data so we can maybe look back and identify some trends based on what we're seeing.
Oh, goodness. I sure hope it's happening. I'm no AI expert, right? People spend their entire careers developing these programs, but there are patterns. I think that's what you're getting at. The way I envision this happening is the programmers and the algorithms do seek input from clinicians. I see this happening already a little bit in practice, maybe not specific to autoimmune encephalitis in my day to day, but there are patterns. It's the questions that we ask of the family and the patients. You know, was there any history of seizures? Was there any history of prior hallucinations? To determine if things are coming out of the blue, or was this the early, very, very, very early signs we might have seen of a psychiatric diagnosis? That's one differentiator, because very often in NMDA receptor encephalitis, there's no warning whatsoever. And sometimes what I've learned from my psychiatry colleagues is a good in-depth history might give them a sense of in the background, maybe something more brewing from a psychiatric point of view that culminated and looked acute. Same thing when we're looking at, in many cases, our older patients and wondering if they have a different type of autoimmune encephalitis. The family or the patient may come to us and say, this happened so suddenly. But when we sit and spend time and ask very specific questions, we may find out that they were just a very high functioning individual. So people didn't notice and they were able to cover up or mask a little bit of loss of some of their edge, if you will, cognitively, until it became a crisis point, and then it seemed acute. So these are the subtleties I hope that AI or data mining would be able to get at, given the right inputs. But that's what we do now, just sitting in front of a patient. We ask these questions. It's so important for us to have what we call good historians, people who know the patient very well, because they're often not well enough at the time we're seeing them to give us this history, but someone who's known them well for years can fill in these little pieces and will tell us the story that helps us to know what direction to go into diagnostically. But yeah, I mean, I think it's ripe for AI, right? Because
Yeah.
if I can ask questions and get there, then AI should be able to do it too.